This segment of Delmarva Life is brought to you by TidalHealth.
May is National Stroke Awareness Month. Did you know that every year more than 795,000 people have strokes? That is an eye-opening statistic.
It sure is. So what can you do to prevent you or someone in your family from being in that group? Well, here to tell us more is Rachel Urban, a speech and language pathologist for TidalHealth Peninsula Regional. Hi, Rachel. Thank you for joining us this afternoon.
Thank you for having me.
So let's start off with the warning signs. What are they that you might see in someone having a stroke?
So we use the acronym BFAST, so balance, eyes, face, arms, speech, and timing. So that just means if you're noticing any change in your balance, your vision, facial droop, it could even be in the eyebrows or eyelids, your arms, usually weakness on one side, difference in your speech, whether that's a slur or trouble thinking of words, and then the T for timing is to call 911.
Okay, so these are symptoms that we could notice about ourselves. Call 911. Is there anything else that we can do until the medics get there or something?
So one other important thing is to notice what time the symptoms have started. So they're going to want to know your last known well when you get to the emergency room, and that's actually going to help decide some treatment options, and that also affects outcomes. So in general, the earlier you get to the emergency room, the more options there are. So for example, if there was a clot where the blood flow is blocked, it's best practice that within 3 hours of symptoms, you might be a candidate for an IV drug to dissolve that clot. So it's really important to call 911 and try and get to the emergency room as quickly as possible.
How can the effects of a stroke differ from person to person?
So there's two different types of strokes. There's an ischemic stroke, which is a clot that is going to block the blood flow. And then there's a hemorrhagic stroke, which is bleeding into other areas. So it depends on the type of stroke. It depends on the severity. So for severity, it could either be a larger cloak or in a more significant spot. So there's actually different parts of the brains have different functions that they control. So it depends what function is affected based on where the stroke was.
Okay, so let's say someone has had a stroke, figured out what it is, did everything we can. Are there things to do to get the patient, be it ourselves or somebody else, on the road to recovery?
So one main piece is that when you're in the hospital, we're going to figure out what risk factors cause the stroke. So we're going to manage those risk factors so that you don't have another. And then we're also going to be looking at your impairments. So at TidalHealth Peninsula Regional, we do have a stroke pathway. So there's certain testing that's part of that pathway, and it also tags all 3 therapies. So speech therapy is one. There's also physical therapy to see how well you're able to walk and able to move around, and occupational therapy, which looks at activities of daily living. So that could be brushing your teeth, that could be getting dressed. We work together to figure out our discharge recommendations. So again, depending on what kind of stroke it was, how bad of a stroke it was, we're going to recommend something different for each patient. So some patients might just need to go home with home health or outpatient services, but for a more significant stroke, we might recommend acute rehab, a skilled nursing facility, so more intense rehab to work on improving from that stroke.
So you can rehabilitate someone so that they can function normally, back to the way they were before the stroke?
That's always the goal, and again, it depends. Everyone is different for how severe of a stroke it is, but we see a lot of amazing progress and a lot of hard work that goes into it for sure. But it is a big part of what we do is starting that rehabilitation process, giving different recommendations and exercises, and those muscles are able to get stronger, those skills are able to improve. So there is recovery after a stroke.
So Rachel, I guess it's safe to say, don't give up.
Absolutely. It's always like anything else, we need to be informed. So we need to know the risk factors, the signs of stroke, what to do. And if we know that, then the rest is going to fall into place with some hard work and diligence.
Rachel Urban with TidalHealth Peninsula Regional, thank you so much. Very important information that everybody needs to know.
Thank you for having me.